Well, few things can derail an athlete's future quite like a traumatic bone injury. And when it's a break to the ankle, treatment and recovery can be lengthy, to say the least. Here in Central Ohio, athletes of all levels know there's a trusted place they can turn to get them healed and back in the game. And I'm happy to welcome back to the show Dr. Terrence Philbin with orthopedic foot and ankle. We also have with us elite college athlete Jaelen Gill. Gentlemen, thank you for being here.
Thanks for having us.
You know, Dr. Philbin, today we're going to talk about ankle injury specifically, and we're talking about both fractures and traumatic injuries. So first, talk about how common these are.
Well, they're very common. They're maybe a little bit less common with COVID, but they're very common. You know, whether you're one of the top running backs in the country or you're a weekend warrior, they're very common. And now with the weather kind of starting to turn, we'll see certainly an increase in springtime as people are just getting out and being more active. So they can be very common.
And what about treating them? What makes that so complex?
Well, I think it's making sure that people are going to have a safe and durable functioning ankle and a good recovery. And the things that make it complex is in some cases it's easy to know which ones are unstable and need surgery. Other cases it's not as quite straightforward as to which ones will require surgery or not. But you know, whether they need surgery or they're treated non-operatively, it's following them along and just, you know, trying to get the best functionality that we can over time safely.
And Jaelen, I want to give our viewers a little background. You were a 5-star running back, heavily recruited player in high school here at Westerville South. So share with us the story of when and how you were injured.
I believe it was my junior year, second game of my junior year. And, you know, I had just a regular carry. I got the ball and, you know, pretty sure it was a clean break on the goal line. And from what I remember, it was obviously, you know, it was a lot of pain. Yeah, it was rough. It
was rough. And I'm sure emotionally, obviously, on top of it being a physical injury for you as a player, right? You're thinking of all the things that could change in your life.
Yeah, exactly. All of that, you know, everything was going through my head at the moment, especially when I knew that, cause when I got to the sideline, I asked, like, you know, am I out for the game? And they're like, yeah, like, obviously, you know, you're gonna be out for the game. But when I really knew it was broken, yeah, everything was going through my head, you know, losing scholarships, you know, everything just like that.
So then, Dr. Philbin, you had to assess it, see what the treatment plan was going to be. So tell us what happened from that point.
Well, he had the kind of injury where very likely his ankle had a twisting mechanism where it was likely stuck in the ground and kind of pivoted around his ankle. So he tore the ligaments in the inside of the ankle. The force went up through the ankle and then came out between the fibula bone, the smaller bone, and the tibia bone. So it was a very unstable injury. And, you know, I mentioned previously the complexity. Some of them, you know, you have to do testing, you have to do stress test, MRI, CAT scan, whatever, to assess how stable an injury is. But this was definitely an unstable injury, and we knew right away it was going to require surgery.
So then from there, what was the recovery like, Jaelen? What did you have to go through to get back to the same condition you were before that?
So I did all of my recovery, you know, at my high school. Dr. Orth, she was our trainer, a sports trainer there. And, you know, she got everything. I'm pretty sure she knew Dr. Philbin, so she got everything from him and everything. So it was about like a 5-6 month recovery, you know, just like all rehab recovery, everything. It was a little tough, but everything turned out great. I was able to play baseball that spring. I was back and running track that same spring right after baseball season. We were able to break a school record and everything. So I was 100% healthy. About 5-6 months.
Yeah, and clearly you're a success story because the backdrop behind you kind of says it, right? You now play college football for Boston College. So Dr. Philbin, you not only have this vast knowledge, I would say, of the medical side, but you can relate to these athletes having these injuries, having been there yourself. So there is some empathy that goes into this as well, right? I mean, you see these guys, these women who want to get back to kind of fighting mode, right?
Yeah, I mean, being a college and high school athlete myself, my freshman year in college, I ended up having a pretty serious knee injury, and that's probably why it is that I do what I do at this point as an orthopedic surgeon. But But I think, you understand for athletes, even if you're not, a 5-star running back, if you're somebody that, say in this case, a junior, and you want to get back for your senior season, we want to do everything to get people back to doing those things. And that was one of the challenges this year with COVID, is kids not being able to participate in sports. And so I'm so happy that things are getting back to normal in that perspective. But yeah, being able to put yourself in their shoes and know exactly what they're going through, and having those open lines of communication with the trainers to help them keep saying that you're okay, everything's fine, just keep pushing through it. You're going to get to where you need to be.
Absolutely. All right, we want to mention orthopedic foot and ankle. You guys are available 24/7, after hours, on weekends. Injuries don't abide by a clock, so that's important to note. And it looks like, you get these guys back to great shape. So it is so good, Jaelen, to hear your story and hear the positive outcome that came from it. So thank you so much for being here and sharing with us.
Thank you. I appreciate you guys for having me.